Welcome to INOVators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting the industry today. Joining me today is Inovalon CEO Adam Kansler, and this episode is part of our mini-series where we look specifically at 2026 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Thanks for being here today, Adam.
Thanks for having me. Always great to be here with you, Justine.
What are some of the key themes in healthcare that really stood out to you in 2025? And tell me how you think that those are going to continue to influence the care ecosystem this year.
Tremendous change in 2025. I think a lot of it driven by some uncertainties around what would happen in U.S. government regulation, how that affects reimbursement rates, membership, many of the factors that go into a healthcare system where vast amounts of dollars pass through that system. Everyone is pressured around costs. So when you start talking about changes in the system, it creates a little bit of paralysis, a little bit of waiting to see how will regulations or rules change? How do our organizations react? You see that across the payer world, across the provider world in particular, but it really affects all parts of the healthcare system. I think as we get towards the end of 2025 now and start looking into 2026, we understand what quality scoring will look like, what some of the regulatory changes will look like. A lot still to happen in the U.S. government around extension of subsidies. You're all aware of what's happening around those issues. We'll see how they settle out, but I think that will come to a significant level of clarity as we get to the early part of 2026. And I think that will then give all parts of the market the ability to change their direction, navigate whatever challenges or changes there may be, and then start to really move forward and address whatever they need to address based on where those decisions come out.
Let's talk about the biggest opportunities and maybe some of the challenges for payers, providers, pharmacies, and life sciences throughout 26.
The number one challenge, and it has been for some time, but it gets even more acute every year, is cost, managing cost. And for different parts of the healthcare system, managing that cost takes on different frames, whether it's reimbursement rates, navigating through prior authorizations, navigating through how a provider can get paid and what they get paid on, and the speed with which they can process that. Coupling that with the efficiency. Providers only have so much time in a day to spend on recuperating the cost of providing their services. So efficiency, cost, speed, these have been themes for years. They're getting tighter and tighter and more important. This is a place where obviously at Inovalon, we're heavily focused on helping create the efficiencies, the speed, and the ability to manage cost in the most effective way.
Tell me a little bit about what you were the most excited about to see make a real difference in healthcare over the next 6 to 12 months.
For sure, that's got to be artificial intelligence. And you read about it in the newspaper or headlines every day. Maybe people have gotten tired of hearing about AI, but it is of tremendous impact. And I think in healthcare, you will see it have an incredible impact. Being able to aggregate medical research history, aggregate all observable medical conditions, being able to aggregate the observable medical information on a particular individual, and then couple all of that together in a very rapid time frame. The very best doctors in the world can't do that immediately. So think about that as a resource for treating patients, thinking about the best way to get people the right care at the right time in the right way to most efficiently get people the care that they need. The power of AI to transform the way healthcare is delivered is enormous. You're already starting to see that come through. There are many applications and capabilities out there, but I do believe that will be the most transformative factor and impact in healthcare, certainly in the near term, but I think long term it will have tremendous impact. That has a number of factors to it. That affects the way providers deliver care. That significantly affects the importance of the data underlying the delivery of that care. I'm sure we'll talk a little bit more about that later, but I think that's where you've seen some real transformative changes and a lot more to come.
And a lot of the conversations we have, even externally around AI in healthcare, the shifts that we've seen in the last year alone are incredible. So I'm sure 2026 will just be even further advancements. But looking at Inovalon's role among all of the change and innovation that is happening in healthcare, talk to me about how we're helping the industry make meaningful progress in, like you said, efficiency, economics, and the care experience overall.
Well, AI is a technology tool. It has to be applied to something. So applying AI capabilities to one of the largest primary source data sets in healthcare, that's where the value is created. We have that data set. Applying that AI capability to a technology tool like a revenue cycle management tool used by a provider, something we provide, allowing that to very quickly process and digest information and make that process more efficient, more streamlined, more cost-effective for the provider. That's where AI is going to have the significant impact. For me, that's the most exciting place where we operate because we do have the connectivity, the tools, and the data sets that allow the application of AI to have real commercial, economic, and patient care value in the delivery of healthcare to the population. So that's super exciting.
Absolutely. I think all of this is very exciting stuff, Adam, and it will be very interesting to see what is to come in 2026. But I appreciate you taking the time to share your insight and sit down with me today.
Thanks, Justine. Good to be here.
And of course, thank you to our audience for tuning in. Be sure to check out our other episodes of the Trends and Predictions miniseries.